So I'm going to talk to you about doubt. My colleagues in the TEDMED editorial team have taken to calling me the cynical medic. So they know that no matter what we're presented with here, I will doubt it. So we get quite a lot of nominations for the stage. I will question every biography, there's a laugh over there, every so-called game changer that we're presented with, a paradigm shift, a clinical claim. My default position is simply just to doubt it all. And I guess I learned to doubt at med school, and when I think about it, I guess they taught us to doubt because it forces us to double-check and triple-check everything, because that's the way that we can be sure about what we're about to do next to a patient. At the end of the day, it's their lives and their quality of life that we're playing with. So doubt is a good thing, and I want to just force us to just have that sentence in our head. Physician doubt is a good thing. Now let's just now imagine those physicians in a clinical environment, and so just imagine a hospital setting, and of course, they will learn which bits of the system that they trust and which bits they want to keep an eye on. So they might say to themselves, so the MRI always comes in on time, I'm happy about that, but those special bloods that I ordered, somehow the lab always get that wrong, so I'm going to get into the habit of giving them a call before my clinic so I've got the results when I see the patient. And you know what? My colleague, from whom I always seek a second opinion, doesn't always see his paperwork on time, so I've got into the habit of walking around to his office and saying, hey, have you seen that request that I've given to you? And just to make sure he or she gives it due priority. What that is an invisible web of trust. It's what our doubt makes us do. It makes us work out which bits of the system we need to bolster and which bits we're okay with. And the web of trust is really, really important to physicians. So we have physician doubt is a good thing. It creates the invisible web of trust in a clinical environment. Now, what's innovation? Innovation is changing a system, and that's simply just going to cause discomfort to the clinician. They're going to say to themselves, wait a minute, the patient's going to take their own blood test and upload it via an app. How do I know they're going to do that correctly and it's going to be in time for my clinic so that I can make a decision? And you're moving my colleague 80 miles down the road into a community-based center because we know we need more community-based services, but I can't walk around to my colleague anymore just to make sure that that referral happens. Essentially, what's happening there is that that invisible web of trust is being disrupted. Now, how do innovators experience that in healthcare? It's those rather unfortunate words that clinicians are known for. Doctors are resistant to change. Some knowing laughs. I'm not sure that's the whole truth. I sort of feel as though that might be a slightly lazy interpretation. Because over here, we had physician doubt is a good thing, but the same side of the coin, or the other side of the coin was doctors are resistant to change. And it seems to me that we see it as a negative. Actually, we have the opportunity to see it as a positive. Because if physician doubt is a good thing, what if we could overcome that doubt? What would that say about our innovation? Surely that means that it would get more traction. And if we follow that all the way through into how we think about innovating, then how do we actually design trust into our innovations? It seems to me that there's a lot of opportunity in there. It takes ingenuity to innovate, but what it really takes to get traction in clinical practice is to understand doubt and build that into trust. Thank you.